If you take melatonin, listen up, there's new research that was presented at an American Heart Association meeting, and it shows long-term use of melatonin supplements might be associated with a higher risk of heart failure and death. People taking melatonin for at least a year had more than triple the risk of heart failure. This new finding casting doubt on the long-term safety of the popular supplement. So we've brought in cardiologist Dr. Jas Kahlon with Banner Heart Hospital to talk about this and, more importantly, what you need to know, because a lot of people do take melatonin. Thank you first for being here this morning.
Oh, thank you. Good morning. Yeah, so it's an interesting study. It basically is looking at chart reviews. So it's not a study where you would normally think that you took two groups of patients and you gave them melatonin, not melatonin, then studied them. That's not how this was done. But still, and we can go through that a little bit, but mostly the important part is that there was increased risk of death, almost double for people who took melatonin for more than a year.
Okay.
And risk of heart failure was almost 3 times. Now, how they...
Very significant
changes with people who are on melatonin. But there are a lot of issues with the study which we need to understand, so viewers should not be alarmed. One is that study was international, so for example, in the UK, they get melatonin prescription as opposed to in the US,
really?
it's over the counter.
Oh, wow, okay.
And the study was just basically chart review, so they never actually saw or examined any patient.
Any of the patients.
They just went by historical data of the charts, and then they went by admission codes. They didn't even know for sure if everybody had repeat heart failure, but if the code was billed for heart failure, that's how it was determined. So even with those caveats, there is some increased risk of heart failure with people taking melatonin.
What happens, let's talk about what happens when you take a sleep aid like melatonin. How does it affect you inside and the other organs like your heart?
So all sleep aids are different. Melatonin is similar to a hormone your body makes, the pineal gland makes melatonin. And it basically, the normal circadian rhythm is that when lights go dark, your body secretes melatonin, so we just augment that by giving you melatonin. But other sleep aids are different, so I think we can't really correlate them with it, but melatonin has been thought to be safe and more similar to natural rhythm of sleep, so it has been recommended. But now I think there need to be more studies which are more, randomized controlled, or at least comparative, prospective studies where you look in the future and then decide if this is good or not.
And this was a big study because it did look at 100,000 people over a 5-year period, but like you said, that wasn't the goal of the study. They weren't purposely following certain people.
Exactly.
So if people do take melatonin, what do they need to know? They don't necessarily need to stop it completely, right? But what should be the concerns?
So I think it's a couple of ways to answer that. One is obviously talk to your doctor, who's telling you if melatonin's good or not. If you already have history of heart failure, probably time to be cautioned about using some different sleep aid as opposed to melatonin until we know more. But obviously adequate sleep is also important. So like if you're having really difficult insomnia, that also does increase risk of heart failure by increasing your blood pressure, by increasing inflammatory markers. So there's no clear-cut answer for everyone to just take from the study. I think the most clear-cut answer is that if you really need it, and you don't have heart failure, you're probably still okay. But if you have history of heart failure or high blood pressure or thick heart muscle, maybe you need to take a different look at your sleep strategies and do other normal healthy things like do a late evening exercise but not too late. Drink like a glass of milk, something which has high tryptophan. Things of that nature, and try to do
down the screens, stop looking at your phone, all those things that help.
Mental relaxation and other things which you can do to improve your sleep. But a lot of those people who take melatonin are fairly insomniac, so they need to, instead of just self-supplementing, probably take medical help and see what is the best strategy for you.
To address it, all right. Dr. Kahlon, thank you so much. We appreciate your insight and a closer look into this study, because it might alarm people at first when you read into it, but talk to your doctor, always the best advice.
Always the best thing.
Thank you.